So, hello again, and let us continue with another video about development and behavior disorders. This particular presentation is done by MBBS students whose names have been provided in the presented by section, and let's get started. So basically, this video will be doing development and problems. Therefore, I'll just skip around to the part of the PPT. So first we have the factors affecting development. So development depends on variety of internal factors such as hereditary, potential, biological integrity, physical and psychosocial environment, and the emotional stimulation. So basically all these factors are there. The more importantly, poverty is one of the most important risk factor associated with poor development, as people who are poor generally have a lack of stimulation. There may be excessive stress, there may be malnutrition, there is exposure to environmental toxins, and there is also concurrent diseases in poorer strata of the society. So prenatal factors which are genetic, which are chromosomal abnormalities like Down syndrome, X-linked abnormalities like Fragile X and other mutation, subtelomeric deletion, all those things. Basically, yeah, a lot of things are there, but yeah, lichens, and phenylketonuria, one of the most important metabolic disorders. There are maternal factors like maternal malnutrition, exposure to drugs and toxins from the lactation, and there are neonatal factors like intrauterine growth restriction, prematurity, perinatal asphyxia. There are postnatal factors like infancy and child nutrition, iron deficiency, iodine deficiency, infectious diseases, environmental toxins, and acquired insults to brain, as in trauma to brain. So you can remember these factors as first of all PNP, prenatal, neonatal, and postnatal. It's okay. Prenatal, postnatal. It's easy to understand. In prenatal, it is GM, grandmaster, maybe. Neonatal, you have IPP, intrauterine growth restriction, uh, prematurity, and perineal asphyxia. There is growth restriction, therefore there is prematurity, there is prenatal asphyxia because the lungs are not developed. You can remember it like that. Postnatal, you have IIIIIEA, IIIIEA. It's somewhat okay to remember. Psychosocial factors, you have parenting, poverty, lack of stimulation, violence and abuse, male depression, maternal depression, and institutionalization. And protective factors are breastfeeding and maternal education. If you educate the mother, it protects the baby, and breastfeeding is the best way to provide all the important nutrition a child needs. Psychosocial factors, parenting, again, sensitivity and affection is very much required for the child. It is similarly institutionalization also deprive social and emotional deprivation and lack of adequate interaction and stimulation is seen in institutionalization. Okay, so domains of development, you have the four um, this thing, four domains: gross motor development, fine motor development, social development, and of course language development. Okay, so next we have developmental delay in any of the four domains which we have told. um, Intellectual disability is decreased level of intellectual function. It is graded based on intellectual quotient. Okay, so developmental deviation and dissociation. Deviation is the acquisition of milestone is in a sequence that is different from usual. Dissociation is that all the acquisition of developmental milestone in various domains at different rates. Um, so causes of developmental delay according to time of insult. Antenatal, you have syndromes such as Fragile X and Rett syndrome, chromosomal disorders, which these are all similar to what we have told before. Involve errors of metabolism, teratogen exposure, muscular disorders. Perinatal, neonatal, and postnatal also have been told. In perinatal, it's ketonuria, encephalitis, hypothyroidism. Postnatal, you have deficiency of B12, iodine, B1, toxins, etc. So management, how is this managed? So autism, first let's talk about one of the commonest one, autism spectrum disorder. So this is there's having problem in the social domain of the development. So there is repetitive patterns of behavior or interest. Globally, it is present in 1 to 2%, and it includes early infantile autism, childhood autism, high functioning autism, Asperger syndrome, disintegrated disorder, and pervasive developmental disorder. Clinical features are language milestone not developed, not babbling, like the child is not babbling by 12 months. There's no single word in 16 months. Two words are purposeful meaning. With purposeful meaning until 24 months is not seen at all. Intelligence is also very much affected, and there is poor social interaction. Causes is not exactly clear, like neuronal abnormalities are seen, genetic causes are there, fragile X syndrome, tuberculosis, sclerosis, Angelman syndrome, metabolic diseases, phenylketonuria, hypothyroidism. All these causes autism spectrum disorder. So pharmacotherapy, first you have medications which are antipsychotics, which works for anxiety, aggression, repetitive behavior. Methylphenidate, which is for inattention, hyperactivity, impulsivity, alpha 2 agonist for hyperreactivity, melatonin for sleep related problems, and iron if deficiency is seen. So next you have very common ADHD, something which I feel I myself have, but I cannot say. It's most commonly seen in children, like 1.3% per 1000, and it can be like observed after like up to 12 years of age. Causes is there is a loss of normal symmetry in the brain, volume is lost in prefrontal cortex and basal ganglia, and there is also dopamine hypothesis. Okay, so the clinical presentation is that the child is basically restless or aggressive in preschool. In cases of older children, they are disorganized and they are inattentive. So management is done by methylphenidate, atomoxylin. Methylphenidate is a non-compatibility blocker of dopamine and noradrenaline by blocking dopamine transport and noradrenaline transport. This increases the level of dopamine and noradrenaline in the clefts. Basically, this is caused by decrease in dopamine and noradrenaline. So, by preventing the reuptake, you can have more neurotransmitters. Atomoxin is also similarly a selective inhibitor of presynaptic uptake in the prefrontal cortex. Norepinephrine uptake is inhibited in. Okay, then there is specific learning disorder. Dyslexia is there, which is impairment of reading, dysgraphia, impairment in writing, dyscalculia, impairment in solving arithmetic. All these children are developmentally normal. 5 to 15% have this, but out of this, 80% is dyslexia. 5 to 15% have all of these, but of these, 80% is dyslexia. Any defect in cerebral cortex is the defect is in cerebral cortex, but the anatomy is normal, so it's very hard to diagnose. Etiology may be familiar or hereditary. 50% is patient suffers, so 50% also have parents suffering. Then you have diagnosis, which is done by history taking. DSM-5 diagnosis, which is very common in psychiatry. Basically, they see the writing, the reading, and the arithmetic skill, and these impairments persist despite intervention for at least 6 months. Then it is confirmed. Management is done by training the parents and the school. There are also tick disorders. Ticks basically mean that they blurt off randomly. There's a very famous Twitch streamer who is a woman. The motor tics are there, vocal tics are there. Motor tics are eye blinking, neck jerking, shoulder shrugging. They may be simple or complex. In the complex one, you have foot tapping, echopraxia, and copropraxia. Vocal tics can be throat clearing, sniffing, coughing, and complex can be words which are told out of context, coprophilia, which are less, coprolalia, which is obscene words, echolalia, or repeating words which they have said, like a parrot, palilalia, which is repeating their own words. Tics are observed fast, paroxysmal, non-rhythmic, motor or vocal manifestation, which may be simple or context. Okay. One of the most common take is Tourette syndrome, which occurs before 18 years and have both motor and vocal tics beyond 1 year, for more than a year. Most common conditions associated with tics are Huntington disease, Wilson disease, and PANDAS, pediatric autoimmune neuropsychiatric disorders associated with staphylococcal infection. So management is behavioral therapy and medication. Haloperidol and clonidine are shown to be effective. Eating disorders, basically two types, which is one is anorexia nervosa and the other is bulimia. Um, Anorexia is the fear to becoming very fat, even though the patient is underweight, mostly affecting 5 to 19 years girls. Bulimia is that they eat a lot of food and they purposely self-induce vomiting, anemias, which occur at least twice a week for months. Both of these are psychotherapeutically managed, nutritional rehabilitation, and treating all the comorbidities and complications. Pica is seen in children who this basically means that they eat a lot of sand, dirt, plaster, charcoal, etc. It's seen in children less than 5 years of age, and it's most commonly associated with iron deficiency, malnutrition, poor socioeconomic status, lead poisoning, or parasitic infections. You can also treatment is by behavioral modification, alleviating the psychosocial stress, deworming, iron supplementation, and treatment of the lead poisoning which was there. Temper tantrums is also seen in children. They basically start punching around wherever is possible. It's a response to physical and emotional challenge by attention-seeking tactics, crying, biting, headbanging, etc. 8 to 16 months age children, and it actually decreases by 3 to 6 years. Basically, distract the child, time out techniques, stay calm, and try to handle the behavior strategically. Breath holding spells, these are reflexes, and because they're caused by anger, frustration, or pain, which is making the child cry. These are rare before 6 months and they peak at 2 years and they just decrease at 5 years of age. They have a history of provocating events and stereotypical pattern of events. They are managed by behavior alteration, trying to be calm with the child and not giving much attention to the child's demand. Thumb suckling reflexes. This is common in infants and toddlers. It peaks by 18 to 21 months and it disappears by 4 years. These are just positive and negative reinforcement can be given to the children, and if it's seen in older children, it can lead to dental malalignment, which is socially unacceptable. So it's better to be treated young. Stuttering, speech defect, which is characterized by hesitation or spasmodic repetition of some syllables with pauses. Usually it resolves by 5 years, nothing needs to be done, but if it's persistent, then you require psychotherapy and speech therapy. They may be having difficulty in pronouncing initial consonants due to spasm of lingual and palatal muscles, but they grow out of it. Enuresis, passage of urine in clots beyond the age where there is bladder control. It is usually seen like 5 years. It can be primary or secondary. It can occur after initial bladder control or for 6 months or more. But you have to rule out diabetes, UTI, and bowel bladder dysfunction. These are managed by behavior therapy with positive reinforcement, bladder alarms, and in some cases, desmopressin is given. And this is also commonly seen is night they wet their beds. Basically, oppositional and defiant disorder. Basically, they oppose and they are defiant and they are disobedient and they have disruptive behavior towards authority figures, which lasts at least 6 months. It depends on the child's characters, parental interactions, family history, and all the environmental factors. And they can be elevated by by elevating risk factor and stress. If they have ADHD, they are more likely to be having this. Therefore, they are given stimulating medications. Conduct disorder. Basically, this is aggressive and destructive activities that may disrupt a child's environment. It may be school, college, environment. Basically, yeah, they are not having good conduct. Then they are managed by behavioral and psychotherapy. Juvenile delinquency, person under 12 years, 18 years of age, who is brought to attention of juvenile justice system for committing criminal acts like using alcohol or drugs. These are managed by parent and family interventions and placing them in foster care. Uh, Munchausen by proxy. Basically, this is a disorder where the caretaker deliberately makes up history of illness in the child and harms the child to create illness. This is the person self-induces or acts out illness to gain medical attention. The abusing child giver gains attention from the relationships and the formed with the healthcare providers or her family, and as a result these problems as a result of all the problems that is created in the child. Parasomnia is abnormal behavior or mode of manifestation seen in sleep. During first of sleep, non random eye movements, parasomnias predominant, and random eye movements predominates in the second half. So the patient will be in the child will be remembering random eye movements on waking up, and when there is no random eye movements, like during sleep, walking tremors and all will happen. During random eye movements, sleep, nightmares, bizarre movements, and abnormal behavior manifestation occur. Condition is usually some self-limiting, but if not resolved, it needs stress management and benzodiazepines. So, and thank you. Back to the chess. A lot of the games I played today are pretty shitty. Rhymes very well. Yeah, a lot of the games were pretty shitty, but again, that's usually common in very low rated games like mine. Here I just realized that I could just give my rook to the other side, then I would win by a very easy checkmate. But it wasn't really easy. Nothing about this is really easy actually. I was able to all the games I played. There was one game which I was really very much mad about. I guess one game which was I don't know why, for some reason it was like I lost, when in reality I didn't really do anything. Like not really, like I didn't do anything. It was more along the lines of nothing. I had more time. I had more time than the opponent. Opponent was literally at like 0-0, but still I wasn't able to move. I lost the game, but yeah, nothing can be done. I lost. I won a lot of games with this thing. What do you say? Overtime. So I guess it evens out somewhere. Just like this game.